Understanding enterohepatic circulation. So, before understanding the enterohepatic circulation, it is more convenient to understand the normal processes for drug. First of all, after the oral administration, the drug is go into the gastrointestinal tract, or we can say the GIT. So, in the GIT, the drug is absorbed into the bloodstream. Then it is transported through the portal vein to the liver. In the liver, the drug undergo metabolism. There is the two-step phase 1 metabolism and phase 2 metabolism. In the phase 1 metabolism, there is simple modification, and in phase 2 metabolism, there is the conjugation. So, in phase 2 metabolism, drugs are conjugated and making them more water soluble, so they can easily excrete out. The primary routes for excretion are kidneys through the urine or the bile through the feces. And most important thing, in this process, the drug is usually not reabsorbed into the body. There is the straightforward elimination. Now we understand the enterohepatic circulation by comparing with the normal process. In the enterohepatic circulation, when the drug is absorbed into the blood from the GIT and it appear in the liver, and it is same as in the normal process, it is metabolized, it is conjugated. So what happened in the enterohepatic circulation, this conjugated metabolites is excreted into the bile, and from the bile it is again released into the intestine. So the drug is conjugated. How can it be reabsorbed? So there is the intestinal bacteria which can deconjugate the metabolites and converting them back into the active form. So now the drug is in the active form. The active drug can then be reabsorbed through the intestinal walls into the blood and return back to the liver through the portal vein, and so re-entering the cycle. So it is the enterohepatic cycle. We can see the enterohepatic circulation, and this recycling can repeat multiple times. So what can happen? Prolong the drug presence in the system and leading to an extended duration of action, means prolonged duration of action. Unlike the other elimination process, which is the normal elimination process, enterohepatic circulation may result in fluctuate the drug plasma levels, means the drug plasma levels is different as compared to the normal one, which results in enhanced therapeutic effects and can cause the toxicity sometimes, but also increase the risk of interactions. And we already mentioned that risk of toxicity, particularly in drugs with narrow therapeutic windows. So it is more dangerous in narrow therapeutic window drugs. So now we understand the enterohepatic circulation, in which the drug is coming to the GIT, which is absorbed by the blood and transported into the liver, where there is the metabolism processes and the drug become conjugated and excreted into the bile, and from bile it is going to the intestine, and then the conjugated drug is converted into the active form, and then this active form is again entered into the blood and again transported by the portal vein into the liver. So it is the cycling process, and it can happen to the multiple times.